Did you know that the same substance that can make you look younger can also stop debilitating migraine headaches, or that the injection millions get to smooth wrinkles is considered one of the safest medical procedures in the world? So safe that doctors don't even worry if accidentally enters a blood vessel. If you want to know the real science behind Botox, stick with me until the end of this video. Hello everyone and welcome back. I'm Dr. Jamalvandi, and on this channel we break down complex medical science into simple, understandable language for everyone. Today we're diving deep into the fascinating world of Botox. What is Botox? The origin story, the bacteria. Let's start from the very beginning. Botox is derived from a powerful neurotoxin called botulinum toxin type A, produced by the bacterium Clostridium botulinum. Yes, the same bacteria that can cause a rare but serious illness called botulism. The transformation. But here's the crucial part. The toxin used in medicine is highly purified and used in extremely tiny controlled doses. It's a perfect example of modern medicine taking something potentially harmful and harnessing its power for tremendous good. Think of it like a powerful medicine. The right dose heals and overdose harms. Botox is all about precision. How does it work? The mechanism. The neuromuscular junction. Every time you frown, smile, or squint, your brain sends an electrical signal through a nerve to your muscle. At the end of the nerve, a chemical called acetylcholine is released, which acts like a key telling the muscle to contract or tighten. The blocker. Botox works by temporarily blocking the release of that key, acetylcholine. When injected into a specific muscle, it intercepts the signal. The nerve is still shouting contract, but the message never gets delivered. So the muscle enters a state of temporary relaxation or paralysis. Because it can't contract, the overlying skin smooths out, and dynamic wrinkles, the ones caused by repetitive movements, soften dramatically. Applications: more than just wrinkles. Cosmetic. The most famous use, primarily for dynamic wrinkles in the upper face, frown lines, glabellar lines, horizontal forehead lines, and crow's feet around the eyes. It's about softening expression, not freezing it. Medical. The powerful uses. Chronic migraine. For patients with more than 15 headache days per month, Botox is injected around the head and neck to dull pain pathways. Hyperhidrosis, excessive sweating, injected into underarms, palms, or feet to block the nerves that activate sweat glands. Muscle spasms, such as cervical dystonia, neck spasms, blepharospasms, eye-controlled blinking. Other uses is overactive bladder, lazy eye, strabismus, and even some dental applications for TM joint disorders. Which wrinkles can it treat? Static versus dynamic. Dynamic wrinkles. These appear only when you move your face. Botox is the gold standard treatment for these. It prevents the muscle from making the fold, so the wrinkle can't form. Static wrinkles. These are lines etched into your skin even at rest, often from sun damage and loss of collagen. Here's the key point. Botox alone will not erase a deep static wrinkle. However, it is still incredibly valuable. By relaxing the underlying muscle, it prevents that wrinkle from becoming deeper and stops new dynamic lines from turning into static ones. This makes it an excellent preventive treatment. Baby Botox, the preventive revolution. What is it? Baby Botox, or preventive microbotox, is a trending and smart approach, especially popular in 20s and 30s age group. It involves injecting very low doses of Botox in targeted muscles. The philosophy, the goal is not to paralyze the muscle completely and erase all movements. Instead, it's to weaken the muscle just enough to soften expression and significantly slow down the formation of wrinkles. The result, you retain full natural facial expressions. You can still frown, look surprised, or smile, but the lines that would eventually become etched into your skin are dramatically delayed. It's like giving your skin a long-term protective shield. Duration, frequency, and the ideal schedule. How long does it last? The effect of Botox are temporary, typically lasting between 3 to 6 months. This duration depends on several factors: your individual metabolism, the treated area, the dose used, and even your lifestyle. For example, intense athletes may metabolize it faster. Certain medical conditions can also influence how long it lasts. When can you get a gain? Technically, you can get a touch-up after about 3 months once the effect starts to fade. However, the widely recommended minimum interval is 4 months to allow the body to process it fully and maintain natural muscle function. The gold standard for most popular seeking maintenance and prevention, the ideal schedule is every 6 months. This timing perfectly balances sustained results with long-term safety and helps reduce the potential risk of developing resistance. Botox resistance, a rare but real thing. Can your body build resistance? Yes, but it is very rare, estimated at less than 1 to 2% of cases. It happens when the body's immune system develops antibodies that neutralize the botulinum toxin protein, making future treatments less effective or ineffective. Who's at risk? This is primarily observed in patients receiving very high frequent doses for medical conditions like severe muscle spasms, not in typical cosmetic use. How to minimize the risk? The key strategies are using the lowest effective dose and maintaining adequate intervals between treatments, which is another reason why the recommended 4 to 6 month schedule is best practice. Sticking to no more than 2 treatments per year for maintenance is a safe guideline. Botox versus fillers. The crucial difference. This is one of the most common confusions. Let's clear it up simply. They are completely different products with different jobs. Botox is a protein that works on muscles. It's the relaxer. Its job is to smooth wrinkles caused by movements, dynamic wrinkles, by calming the muscle underneath. But dermal fillers, like those based on hyaluronic acid, are volumizers. They are plumpers. Their job is to fill in static lines and folds, like nasolabial folds or marionette lines, restore lost volume in cheeks or lips, and fill hollows under the eyes. The simple analogy. Think of a crease on a leather sofa. Botox would be like loosening the spring underneath so it doesn't crease as much. A filler would be like stuffing more padding into the crease to lift it out. They are often used together for comprehensive rejuvenation, but they are not interchangeable. Safety, side effects, and a key insight. The safety profile. I want to emphasize this. Botox is arguably one of the safest cosmetic and therapeutic procedures available. Its safety is so well established that during injection, most experienced practitioners do not aspirate. Pull back on the syringe to check for blood. Why? Because the dose per unit is so minute and localized that even if a tiny amount accidentally enters a blood vessels, it is systemically insignificant and poses no danger. Side effects. They are typically mild, temporary, and localized to the injection site. Slight bruising, swelling, redness, or a mild headache. The most discussed complication like ptosis, a drooping eyelid, is also temporary and resolves completely as the effects of Botox wear off. We will have a separate video that in that video we will say completely about the side effects that we will put the links here. If you like, you can see it. Minimizing risks. The single most important factor is seeing a qualified medical professional, someone with in-depth knowledge of facial anatomy. The second is proper aftercare, which will be the topic of a dedicated next video that I will put the link at the end of the video. So Botox is a purified neurotoxin that temporarily relaxes muscles. From Baby Botox for prevention to treating medical conditions. It's a versatile tool with an outstanding safety record when used wisely. The takeaway, whether for prevention or correction, the pillars are education, choosing an expert injector, and following a sensible treatment schedule. If you found this complete guide to Botox helpful, please give this video a thumb up. It really supports the channel. Don't forget to subscribe and hit the notification bell so you don't miss our next video where we'll cover all the essential aftercare tips to maximize your results and minimize side effects. And a question for you. Let me know in the comments, are you considering Botox more for prevention, I mean Baby Botox, or for correcting existing lines? Thank you so much for watching. Until next time, take care.